Welcome to Session 2 of the Quality Management Training Program. In this session, we'll have a look at the ways that service providers can monitor the quality of their services and the importance of service user feedback in that process. And we'll have a look at the Disability Services Standards and the KPIs. We'll start by having a look at monitoring quality. Monitoring the quality of your service is an ordinary part of the regular review and evaluation and reporting that you do. It involves collecting and analysing information, and you also need to have indicators, ways of knowing how well key aspects of the service are performing. There are several key indicators for a quality service. A quality service receives positive feedback. People that are using the service let the service know that they're happy and satisfied with the service they're receiving. It's also important that outcomes for individuals are actually achieved. So a quality service is one that actually makes improvements for people, that's effective in what it does and the way it meets the needs of people. A quality service also meets industry or service standards. The standards are a benchmark, and a service provider can use these to measure themselves against those standards. So these three things give you a sense of the quality of the service. To monitor quality, you need performance indicators. You need measures that will tell you how well you're performing. What's important with performance indicators is keep them simple. There's no need for things to be complicated. Always think about what will really tell you that something is working well. Make use of your existing data. Don't go thinking of new indicators that are going to require a lot of work to collect information for. Have a look at the sorts of information that you normally collect. If you are going to have indicators that require additional data, make sure that it's easy to collect and that you're not setting up indicators that you can't really collect data for. Data should be used. It should be used to both track how you're going and to also drive the changes that you're trying to make. So use performance indicators both to keep track of quality, but also to drive the direction you want to go in. Indicators do not need to be complicated. Let's have a look at some examples. So things like the numbers of people that have actually successfully been helped, the levels of satisfaction that they have with the service, the achievement of positive outcomes. These three are probably the most important in terms of measuring the way the organisation has provided service to people, how effective it's been, how well received it's been. There are also things like staff morale, which is an indicator of how well the organisation is going internally, whether there's a positive profile amongst your stakeholders, what do other organisations and people think about the service. And of course, the Disability Services Standards key performance indicators themselves, the KPIs. All of these can provide you with measuring sticks for seeing how you're going. We're going to have a look now at some of those indicators in a bit more detail, starting with the Disability Services Standards KPIs. These KPIs provide a way of measuring your performance against the outcomes of the standards. So they're directly linked to the standards. They can be used to measure improvement over time, so from one period to another. They can also be used to set targets to sort of link your continuous improvement to. They give you baseline information, so the first time you measure against the KPIs, it sets in place a baseline. you know how you're going at this point in time, and then you can start to measure in the future how you're going as you move forward. They provide an important part of the information for your self-assessment against the standards. As I said, they're directly linked to the standards, so they provide a measuring stick, if you like, for aspects of the quality standards themselves. To finish this session, we're going to have a look now at service user feedback. This is one of the most important indicators of quality. Clearly, if people receiving service are not happy, then something is not working. So, service user feedback includes complaints and hopefully compliments, but also comments and information that might be gathered either through specific feedback collection or just through the general interaction that staff have with people using the service. This feedback tells you about two things: the satisfaction that someone has felt, whether they're happy with the service, and also the extent to which you might have met their needs. It tells you about how the service is seen by service users. To get an idea of what things might look like from a service user perspective, it's a good idea to have a think about it from your perspective when you are in a position of being a service user. So have a think about how you would make a decision about a service provider, either for yourself or a partner or a relative or friend, someone close to you. What would you look for? What would be the critical factors for you in deciding between two service providers? And would there be anything in particular you'd look for because of a specific situation? For example, if you're a carer, or you have a particular type of disability, or you're from a particular community or population group. By thinking about it from your own position as a service user, you get a sense of what people are looking for, and then you can look at your service and see, how would you measure up if you were the person looking at using that service. To finish our session on service user feedback, it's important to keep in mind when you're engaging with service users and looking for feedback that it should be a two-way process. People who are providing feedback need to know what will happen with the information they provide you. They also need to feel safe if they're going to be providing negative feedback, and they need to feel valued. They need the feedback they give to have an impact. So if you're going to be using the suggestions that they make, they need to hear about the changes that might have been made in response to their input.